we waiting for something?
Good afternoon, everyone. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic called kidney stone. Renal calculi or kidney stones are hard, pebble-like pieces of material that form in one or both of your kidneys when high levels of certain minerals are in our urine or in our system. So, if we have these symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as a urinary tract infection. And for that, today we have with us renowned urologist, Dr. Harsha K, with us, who is MS, MCH in urology. He has a rich experience and hands-on expertise in urology, BPH, and stone management. And he is currently practicing at Manohari Superspecialty Hospital and IVF Center, Tirupati. A very warm welcome to you, Dr. Harsha.
Thank you. Thank you for your kind words.
So, Doctor, as today we are talking about kidney stones, and kidney stones or renal calculi are quite common. So, what are these kidney stones?
So, basically, kidney stones they're basically stones, any stones. So, when they form in the kidneys, we call them as renal calculi. But usually, when we mean kidney stones or when the patients come with kidney stones, it doesn't mean that the stones are only in the kidney. So kidney usually means there's a tract that is, kidney drains its urine outside through a couple of tubes called ureters. So when kidney stones form and they drop into this ureters, that's when the patient starts having symptoms. So basically and generally, we use the term as kidney stones or renal calculi, but it can be either kidney stones or it could be ureter stones or even in stones in the bladder, sometimes even in the penis, like when the stones comes to blast and then get stuck. So you still call them kidney stones as a general term so that everybody can understand. So basically, they're just calcium concretions that form in the kidneys.
Okay. And doctor, what are the symptoms associated with kidney stones?
Like I said, usually the symptom starts when the stones drop down into the ureters. As long as the stones stay in the kidneys, we don't have much of symptoms. But once they drop to the ureters being very small 5 mm tubes, even if it's small stone like say a 4 mm or a 5 mm stone, when it gets stuck in the ureter, the urine on that side stops flowing down and the kidney starts putting a lot of pressure to push the urine. That's when you start having symptoms, especially like pain in the back that radiates to the front. That means the pain, you feel like the pain is coming down from your loin to your groin, to your pubic area. And the pain is so severe, the patient starts writhing in pain on the bed and all that. And you start feeling a little nauseous and you might have a couple of vomitings. And sometimes you'll have pain during avoiding urine. That is called dysuria. Sometimes you might have blood in the urine. So all these usually points down to kidney stones. And especially if you have already had kidney stones in the past, the patient typically remembers what kind of pain it is. And you never forget that pain. It's usually the worst kind of pain that we can have.
All right. And doctor, could it be asymptomatic as well?
Asymptomatic, yeah, especially if they're in the kidneys. So even the stones, at least, as long as they're in the kidneys, usually you don't have any pain. So even if the stones can be, the stones can grow even as large as 3 centimeters and you might not have any symptoms. Only when you start having some kind of infection or some kind of block, that's when you start actually having some kind of pain. Or it could be so dull, the pain could be so mild when the stones are in the kidneys, you might think that probably it's some kind of a backache or just some kind of muscle spasm and you start ignoring. But it could actually mean kidney stones.
And doctor, what causes these kidney stones?
Well, that's a very broad question, but I can answer with a simple sentence saying that probably the lack of water. So stones as in stone is nothing but an excess of salt in your water or salt in the body. So it could be any kind of salt. So usually when we are in school, we learn this small science experiment called where you put salt in the water and it starts crystallizing after a certain point of time. So you put some salt in the water, it dissolves completely. You put some more salt, dissolves completely. You keep adding salt at one point of time called a saturation point. It starts forming into, the salt starts sedimenting at the bottom. The same principle holds good with the kidney stones as well. So when you add a lot of excess salts, which are not good for the body or not good for the kidneys, and the water is less, so either the salts are more or the water is less. And after a certain point of time, the kidney stones start forming. This is usually the most common cause. The other causes being some basic abnormalities. Say the ureters are narrow or you had a previous surgery and you had some kind of damage. or you're not able to pass urine normally as you usually should, either because of some abnormality by birth, or say some accidents, or say due to old age. These are other causes that can lead to kidney stones. So it's basically excess of salt and decrease of water, to be
Right.
generalize.
And when you said, less water intake, then we also have this notion of, having plenty of water. So, what's the right definition of water? I mean, adequate water. Because many a times people end up drinking a lot, then many a times there is a lobby of people who hardly drink water. So, how to maintain that balance, doctor? How much is adequate?
Yeah, that's a very important question. And again, and it depends upon the type of individual, what kind of work they are into, what is their weight, what is their height, the gender, all these factors come into play. But usually, if you ask me how much amount of water for for an average individual, it's usually around 2.5 to 3 liters of water. Even say if you are in like high physical work, like say you're outside contractor or some kind of construction worker, probably you need a half liter more because you sweat more. You're a very muscular person, probably another half liter. Or if you're a very thin built female or something like that, and you're mostly at working in an air conditioned space, around 2 liters should still suffice. But I've had recently even one patient saying, I've heard over YouTube that plenty of water is good, and the individual started having 5-6 liters of water, 6 liters in the morning. That too, that's definitely not good. And when you say when I say 2.5 to 3 liters of water, you should space it throughout the day, not like have 2 liters of water in the morning, not have anything in the full day, and then have another liter in the night. It should be well spaced. Probably have hourly water input. Maintain that. There's a lot of apps which remind you to have some water after an hour. So that could do the trick.
Right. And doctor, what all treatment options are there for treating kidney stones?
Right. So again, kidney stones, when you say patient has a kidney stone, not everybody needs a treatment. So it could be a very small stone in the kidney. It could be just coincidentally picked up on an ultrasound scan done for some other reason, or the patient could actually come with the pain and then be diagnosed with a stone, usually a ureter stone. So, like I said, when the stones are in the ureter, they tend to pass normally through the passage and then tend to come out, as long as they are smaller than the size of the tube. Size of the tube being 5 mm. So any stone that is smaller than that usually passes. 90% chance that it will pass. Any stone that is slightly larger, say around 5 or 6 mm, with some kind of medication, there are medicines which actually enlarge the tube, that dilate the tube. So even 6, sometimes even up to 7 mm stones, they usually pass out spontaneously. You can wait up to 3 to 4 weeks. You don't have to hurry and then go for a surgery. But any stone that is larger than that in the ureter has to be treated. Any stone that is larger than 1 centimeter in the kidneys has to be treated. Stones smaller than 1 centimeter, as long as they are in the kidneys, usually can be waited. We can wait and then probably follow up with the repeat scans and all that. Now there are multiple options, even surgeries. You don't have to go for anything invasive. You don't have to even get a small cut, or there's just a daycare surgery nowadays with incoming lasers. So you go through natural urinary passages. There are many surgeries called PCNL, RIRS, wherein you directly visualize the stone and completely laser it. That is, using laser, we completely powder the stone so that not even small bits are left over. We completely remove the stones. But everybody doesn't need this.
Right. But at least it's still a big relief, because otherwise we used to feel that kidney stones, especially bigger the size, the bigger the surgery is going to be. So as you said, now so many, advanced procedures are there. So that's a good news for
Sure.
all of us. Now, doctor, the thing is, with kidney stones and all, people also have this tendency. You also said that once a person have a kidney stone, he is prone to have it again and again, recurrence of stones. Why it happens
Very
and how to prevent that?
true. So, if a patient or a person has a stone or diagnosed with the stone for the first time, there is a very high likelihood, that is almost a 50% chance, that he or she might develop another stone within the next 5 to 6 years. So that's a very high incidence rate. So this happens because, basically, there is some reason for you to develop a kidney stone. Even if I have 2 liters of water, even if another person has the same 2 liters of water under the same condition, he or she might form a stone, I might not form a stone. That means basically the person is having a tendency to form a stone. So he or she actually needs to improve their diet and water and all that more than a regular person. So that means there is a generalized tendency that the stone is forming. So this tendency will keep the incidence rate very high. Also, once there is a stone, the fresh or new stones usually form much easier on this already stone. They get stuck. The new minerals, the new minerals, they come and get stuck to the old stones, and the stones start enlarging a lot more. So that's why usually people with stones tend to have more and more stones. So, and there are unfortunately all the treatments right now that are there are for the stones that are already there, and there is no proper treatment for the or proper solution for the to prevent future stones, medically at least. But generalized lifestyle management like increased water intake and some diet modification can prevent these stones.
As you mentioned about diet modification, what could be the dietary precautions that we can take, or some do's and don'ts?
Okay. All right. So there is one notion that most of the stones are calcium stones, which is actually true. So people start avoiding calcium, which is again not true. It actually works negatively. So most of the stones are calcium, but calcium combines with something else called, say, an oxalate or a phosphate or something. So that actually forms a stone. When calcium is always there in the body, whether you take it or not. So when you actually don't take calcium and there is excess of oxalate, there is excess of phosphate, which could have otherwise gone through your motion or your stools. When you've taken food, it usually goes off. And there's calcium in the food as well. The oxalate combines with the calcium and it goes off instead of getting into the body. But when you don't take calcium and you just take oxalate or phosphate, it goes in, and with the calcium that is already there in the body, it forms a stone. So calcium is actually a good thing. You should include calcium in your diet, not avoid calcium. So that means you don't have to avoid dairy, you don't have to avoid milk. You actually take, you don't even need to avoid your calcium tablets. They can be taken along with the diet, even though you're having stones. Most patients say, sir, I've been taking calcium tablets, probably that's why I have stones. That's not true. So you should not avoid calcium. Second, avoid salt. Salt is something which is very bad, that actually tends to increase your calcium in the urine, which is not good. Calcium in the bodies or calcium in the food is okay, but calcium in the urine is not good. That happens when you take a lot of salt. So strictly avoid salt and high salt intake. Then a lot of animal protein is not good, especially red meat, like say buffaloes and mutton, and all this beef, mutton should be avoided. Fish and chicken in moderate amounts is still okay. Like I keep saying, oxalate, which is not a good thing. So diets rich in oxalate, like say spinach or chocolates or nuts, better avoid, especially if you're already having kidney stones. And most importantly, 70% of the treatment is an increased water intake.
Right. And doctor, before we sum up this session, any take-home message or anything that you would like to tell our viewers?
Just drink lots of water, and if you're having kidney stone, kindly get it checked and go for regular scans once in 6 months to at least once in a year. Just if you've already been diagnosed with a stone and if you don't have pain, please don't ignore it. It could still mean that the stone is there and there is a chance that it might be affecting your kidney. Just get it checked. It's a simple ultrasound scan that can diagnose the stone. There is no harm of radiation and it's very safe.
Right. Thank you so very much, Dr. Harsha, for your valuable time. It has been a very informative session for our viewers as well. Thank you so very much.
Thank you so much. Thank you.
And viewers, thank you for joining us. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.
Thank you.